Happy New Year, everyone, and a warm welcome to the very first series of Chiropractic and Physiotherapy, Health and Wellness. Today, we want to talk about a very common spine health issue, and that is disc bulges. So, have you ever been diagnosed with a disc bulge and you are scared, confused, overwhelmed? Then this episode is for you. We get very many patients coming in with diagnosis of disc bulges, and they are in panic mode and they're asking, is my spine damaged? Mgongo imeharibika? Is surgery inevitable? Now today we want to talk about what are disc bulges, what they are not, and when they actually do matter. Now, this is to help you understand your spine health better and to remove the fear from back pain. Joining me to discuss this particular issue is our chief physiotherapist, Dion Jogu. Dion Jogu has been in the profession for over 43 years. Welcome, Dion.
Thank you very much.
Happy New Year.
Happy New Year to you.
All right. We also do have our very own chiropractor. She's an international chiropractor and she's been with us for over 2 years. Dr. Petty, welcome.
Thank you very much.
And Happy New Year.
Happy New Year to you.
Dr. Petty, tell us, do you have a lot of patients coming in panic mode? And why is spine diagnosis creating a lot of fear?
I would say mainly because of lack of knowledge and understanding. And again, being misinformed, hearing from your neighbor what might be happening to your back might be a bit risky than actually hearing from your primary health care provider. So it's very important that when you do get either your MRI or any imaging done, you'd rather go to your health provider to give you a full explanation of what's happening so that it excludes all these other fears that most of the time are not rational.
Okay. Dion, in today's world, whenever someone has back pain, the first thing they're told is go get an MRI, go get imaging and all that. Are all issues dangerous? Everything that is found in MRI, yeah?
Not really, because MRI is to locate what could be causing discomfort or pain in you. Because MRI will give you soft tissue explanation. But most of us, whenever you get a problem, the first thing is to do a plain X-ray, depending how you got the complaint of low back pain. Otherwise, it is not that dangerous.
Okay,
Yeah.
all right. So we once had a chiropractor who had to diffuse a situation. A patient came in very panicked and were like, oh my goodness, my disc, it is out and all that. And the chiropractor said, you're lucky you even have discs that are out. The others without discs. And it really did help the person to calm down. But let us now just explain exactly the spine and this disc issue in layman's language. Yes? So do you want to take us through that? Yes, the structure of the spine.
Structure of the spine, we call it vertebral column. The vertebral column hosts the spinal cord. The spinal cord is the cells which the nerves originate from. So for every part of your body that is below the neck, below the head, is all what we call peripheral nerves. So these ones are hosted in the spinal cord. So because it's a very sensitive organ, we have it being hosted and protected by something we call vertebral column. The column itself is like made of bones. Very small bones like stones being built together from the neck to what we can call the tail of the spinal column.
Okay.
The spinal column is divided into 5 sections. Now each section has origin of the nerves and they supply a certain area of the body. These 5 sections is For example, we start with the neck. The neck is where the nerves of the arms and across the chest come from. So that is well protected by what we call cervical column.
Okay, the neck
Yes.
part of the spine.
Yes. The next one is called, we call it thoracic. I'm sure everybody understands what is thoracic. This is where the ribs, like a cage, but the ribs support themselves to the vertebrae, which is the bones which cover the chest. And that way the nerves which are coming from there, majority to help inside the chest and others a bit of periphery.
All right, so that is for the upper back.
Upper back or mid back.
Okay.
The third one is what everybody calls the back. The lower back. But in our terms, we call it the lumbar. The lumbar hosts the nerves which supply along the waist and the lower limbs, all of them. That is the lumbar, which is very well mobility. It's very mobile, more than any other part of the 5 sections. Then we have what we call the sacrum. The sacrum is like a seat for the vertebral column. So when it is, the spine always supported from there. So the spinal column can move from side to side, front, behind, turn round and round because it has a fulcrum where it can turn from.
It's a pivot point.
A pivot point for the vertebral column. But don't forget the spinal column is inside. The last one is what we call the coccyx. So when God was creating the vertebral column, he didn't finish it flat because it is a sacrum, but he felt it produced it just like a small bone, which is mostly not functional, but it beautifies the nature the way the spinal column is. Now from there, inside the vertebral column, it's also having structures inside.
Okay. And just before you go to now the structures of now the disc bulges, I'd like Dr. Pete to just tell us how strong is this spinal column, given that it's hosting the spinal cord. Yeah, how strong is this particular structure? Because a lot of us think it's probably fragile. Yeah.
Okay, so when we talk of the spine, we are talking of mostly the essential mobility that you have, bending forward, bending backwards. So it
Twisting.
has twisting. So it has a lot of motion that is incorporated into it. So there has to be a lot of flexibility. And that being said, it's also supported by a lot of muscles, right?
Okay.
In order for it to be standing, for us to be standing. So it's a combination of flexibility and stability. Yes, so it must have both components. In a way, we are to say there's a level of protection that it should have, but also there is a level of responsibility that we have to maintain good health of the spine. Because as much as we need it to be flexible, we need it also to be able to sustain us, to give us balance. So things like that have also been maintained by the nervous system as well, giving proprioception to the spine, so that if ever you're overstretching or overdoing something, those nerves will shoot and allow you to kind of get back into a healthier position. So in a way, maybe not too strong, but very smart.
Oh, very smart.
Very smart.
And
it's coordinated also with how well you take care of yourself, how strong your core is.
Okay.
So everybody has a spine that they should have some level of responsibility in taking care of.
Okay, all right. So, Dion, we can move on to understand. We've understood now the structure of the spine and how
Yes.
it is small bones over each other.
Yeah.
And so, where are the discs? How do they come in?
What we can do is take a part of the vertebral column and I will do it on the lower part of the back because that is where most people come with the discs. When you look at this picture, you will find that in the middle of the vertebral column, there is something we call spinal cord. And I said spinal cord is where the cells which carry the nerves originate from. So to protect this spinal cord, because if you hurt the spinal cord, you will injure the nerve which supplies the muscles or the areas of the body. For example, if you hurt the nerve of the, let's say, on gluteal muscles,
The
automatically, yeah, bottoms, automatically you will stop feeling it, which means you have killed the cell which that nerve comes from.
Or you'll start feeling numb.
You start feeling numb or even not feeling anything.
Oh, okay.
So now with the spinal cord in the middle, we have the vertebra. I'm sure everybody has done biology in school. A vertebra is that bone, the small bones we talked about. This bone has a hole between where the spinal cord passes through. And since we said the spinal column keeps on moving, it is not stiff, it is flexible. You have to turn side bed, the apple to move that way, that vertebra. For it to be able to move that way, there is a joint between one vertebra and the other one. And the joint is called facet joint. The way you have a knee to move your knee, the leg, the same case the vertebrae have a joint where they keep on moving from. Then from there, the spinal nerve coming out of the spinal cord comes between one vertebra and the other one. And that is what we call the spinal nerve, which comes to your arms, to your legs, to your back, to every part of your body. But the two bones between the two vertebrae, there is what we call a cushion. And this is what we call the intervertebral disc. So that is the structure of the spinal column involving its particular elements of what it does in life. So the disc protects the vertebrae not to collapse on one another. Cushions.
Shock
Then
absorbers.
maybe.
Yes.
And then the nerve comes out between the hole where the joint and the disc are leaving space. And that is where it can get out slowly to go where it is supposed to be done. And that is the way the spinal column is made.
Okay.
Yeah. Yes.
Okay. It's a very intricate structure.
Yes.
Right. So, Dr. Petty, then how does a normal disc look like, and how is a disc bulge? Right. So possibly you can take us through that.
Okay, so a normal disc basically has two components in it. It has the nucleus pulposus, which is the soft stuff that's inside, and then it has the outer fibers now that are going to now protect the nucleus pulposus. Now, these components ensure that there is cushioning and ensure that there is no rubbing between the vertebrae, right? And ensures mobility at the end of the day. So now a normal disc has to give space between the two vertebrae. And sometimes it happens that because of our ill movement or no movement or let me say, lack of movement there, of like sitting for too long, there is an amount of pressure that is put unevenly to the spine, right? So now when this pressure is put unevenly, it can cause the disc to bulge in a certain direction. I normally describe it like a balloon between your two hands. So if you take a balloon and you squeeze it between your two hands, the balloon will bulge out, right, between the hands. And then now if you start putting pressure on one side, what will the balloon do? It will bulge to the other side. So at the end of the day, we try to explain to patients the kind of pressure that they may be putting into the disc that causes what in essence we call disc bulges. Now, if you look at the images, you'll see that at the top there is a normal disc, which consists of a good amount of space that allows that disc to be spread out evenly, right, and not go out of the edges, right? And then when you look at, you jump that degenerative disc and go into the bulging disc, you'll see now this one has a bit more pressure towards the back, right? Now it's caused the disc to now push its way towards that area that the physiotherapist was describing, where the nerve is supposed to come out. So it depends also on the amount of pressure and the amount of bulge, or when we say bulging, it means it's moving out of its circle or environment, now pushing into another area. So if you look at a line, if you draw a line right across the end of each vertebra, it should be the disc should be within those vertebrae. But the minute it moves out, it is bulging, right? So it can bulge, but that does not mean that it is now compressing any nerves as yet. Yeah. So depending on how much bulging has happened in a particular disc, then we can grade how much damage, or I don't want to say damage, but how much inconvenience it causes the spine.
Okay. Dion, so Dr. Petty has said in between the vertebrae, it's like a balloon.
Yes.
If you move forward, it bulges on this side. If you move this way, it bulges on this side.
Yeah.
Meaning it is constantly happening. Like
Yes.
if I'm to go
Yes.
sideways, there'll be a bulge on this end. If I do this, there'll be a bulge on this end. So is it possible that even as we sit right here, right now, I'm not feeling anything on my back, but I could be having a disc bulge?
Yes, our lifestyle matters a lot in care of the vertebral column. If you sit for too long, the base where we said the vertebra is located, it's not mobile. It is sort of fixed. So if you sit for too long, that is your body weight will keep on being distributed the whole way to the last part or last disc of your spine.
So there'll be more pressure in the lower discs.
The lower discs, and that's why majority of people suffer from lower back. So when it is pressing too much, the disc will have to give way to be able to relieve
The pressure.
Yes.
Okay.
So it depends the posture you will take to relieve that pressure. If you move too much on your right, automatically the balloon will go that side. So slowly you'll find the bulging of the disc going to the left. And later you'll start complaining of discomfort on that side. Why? Because the space between the disc and the nerve space will be reduced. So then disc will start irritating or pushing to tell the nerve to move a bit for it is what will cause the irritation. But it will depend to what degree has it taken. It can bunch, but it doesn't close the root of the nerve.
Okay.
So you will never know whether it is having any effect. Sometimes it can be too much and it becomes even like sudden. You feel so much pain on that because when you are sitting or whatever you are doing with that weight, you sat in such a way that the disc had to go more and it really pressurizes on the nerve directly. That is when somebody will say, I'm in severe pain. So it means the degree and the position the bulging has gone to. Yeah.
Okay. Dr. Petty, are there cases where so people have disc bulge, but one person, the disc has really bulged, but no symptoms at all, no pain, no nothing, and yet another person where the disc bulge is very mild, but they're in a lot of pain, right? Are there such cases?
So I would firstly like to say a human being is God's creation. With that being said, people experience symptomatology differently. So and the outside of just the disc bulging, there's other components like muscle spasm, ligaments being sprained. So even the disc being sprained. So there are other elements that can cause pain outside of just the disc bulging. Hence, it is very important to look at all components when you are consulting with a patient. And imaging just gives us a part of the story. And sometimes imaging just confirms what we might be suspecting. So the biggest giveaway is to understand the story behind what happened to the patient and also understand the information that's been given to you in terms of imaging. And sometimes even the imaging, if it's not there, you can tell this person probably has a herniated disc, given the symptoms, of course. Hence, it's very important to consult as a patient in order to understand your condition. So I wouldn't say that those are like defining ways to say if someone has a really bashed disc but there's no pain. So there's more components involved in that. Therefore, that's why we need to take full examination and understand the case.
All right. So the scan is not necessarily the only thing you take into consideration.
Yes.
When someone comes in with back pain.
Yes.
Right. So another question is, we've got people who are in very manual jobs, construction workers, drivers, also housekeeping, people in housekeeping. And if they are diagnosed, the MRI is showing disc bulge, should they stop working? Should they stop moving and just rest?
Not really. Because when you go to construction site, that person must be trained before they start doing the job. How to carry, how to lift, and how to push. So that they are trained not to use the small muscles or the thin muscles of the spinal column. They should use the powerful muscles of our legs and glutes, because those are the muscles which are supposed to be working. So if the person uses the proper posture to be doing these jobs, he will never have those bad back problems, even in a herniated disc. And we have said you can have a herniated disc which has no symptom.
Yeah.
The drivers is that because they sit for too long when they go long distances, and because of the way we say the pressure on our discs, it makes them have those herniated discs. The only thing is to train the drivers either to be using a cushion, which will be absorbing the pressure of their body when they are driving. The other thing is to make sure they stop in intervals wherever they are traveling to, so that they give relief to the spinal column. When you get this disc, it doesn't mean it is the end. It's not only the drivers or construction people who get the disc badges. Even people in the offices do. It doesn't mean they go home and stay. It means it is either a posture they took which caused the disc to bulge and to pinch their nerves. So the only thing is to go, as Dr. Peter said, get to see your consultant or your doctor who will be able to understand the story where this discomfort of your lower back came from. So nobody should stop working because of a disc bulge. Because the disc bulge is not the problem. It is the way you do the job, which could have caused the whole problem.
The whole problem.
Yeah, so they should they look for help, and they will be helped to go back to their job normally. Yeah.
Okay. And just in the same line, as we saw the disc being some sort of balloon, Dr. Petty, what helps the spine recover from, say, if the disc has bulged this way and then you come and bend backwards and it bulges the other way, what helps the spine just keep recovering from such movements? Because such movements are daily. You're bending forwards, you're bending backwards, this. What makes the spine, what gives it that agility to just bring back the disc into position? Yeah.
So, like I said earlier, that the spine is massively supported by the muscles, specifically to say your core muscles. And also, once you start looking at the spine and all of those muscles as a system, it will make sense why the spine is the way that it is, because it's supposed to accommodate flexibility and accommodate some stability. So the reason that we need to be able to strengthen those muscles is because we want them to be supporting the spine. So the way that we are able to support movements of the spine is by supporting our core and the muscles around the spine. Yeah.
Okay.
So strengthening your back is very important.
Strengthening the back and the core.
And the core, yes.
All right. So it actually helps the spine recover from whatever positions.
Movement is actually supposed to be there. The spine is created for movement. If it was supposed to just sit still, there wouldn't be discs in there. So,
okay.
So the discs are actually supposed to have those bending. The problem is when now it's consistent, you're sitting for too long, and it's every day, and it's a bad posture. Remember, the spine has curves that are allowing certain amount of pressure in a certain direction. So immediately you have those curves being altered. Now the force that's going through to those discs is different from the normal one that is supposed to be there. But that's okay for a bit, for a second, for a minute. But then if it's happening on a daily basis, you're sitting on a chair on a daily basis in a wrong way, or you're pushing stuff, big things in a wrong way, then that's when
it's
it
very
becomes
consistent.
Yes,
for a very long time.
So your body first takes it and tries to cope with you, and hence most of the time people are injured by the things that they do on a daily. Like someone who says, I've been going to the gym for quite some time, but this time when I went to the gym, I picked up a weight that I'm not used to, and there. There's a bulge, or there was a pop that came through. So sometimes you've been giving that pressure that's unnecessary, and your spine was coping until to such a time where it's not.
It says no more. I
Yes.
cannot handle this
So
anymore.
it's very important to make sure that you are taking care of what takes care of your spine, which are your muscles, your core, and all that.
All right. So you've just said something very interesting about the spine having different curves. Yeah. And if we
Yes.
can just go back to that particular picture
Sure.
where the spine has got different curves, what makes in our daily lives, what do we do that now affects the curves? What is the impact of those daily activities that we have that affects the curves, and what can we do to stop us from creating so much pressure onto the spine? Yeah.
If you see the way Dr. Pete has said, the spine column is usually supported by muscles. It has very strong muscles and ligaments, which is supported to remain in those curves. So if, let's say, take the neck, and you change the position of that curvature of like a C, you make it flat, like a military person, automatically you are making the muscles which are supporting the spinal column weak.
Military people have
Straight neck.
straight necks.
It's not curved, like a C from behind. Immediately you see you have lost that curvature. You have weakened the support of this, let's say, the cervical vertebrae.
All the muscles around.
Around there they get weak. You have weakened the whole system of the cervical vertebra. And this will cause pinching of the nerves of the upper limb. So the only thing is to make sure that the muscles, the ligaments surrounding your neck mass, the vertebra, are always in a good position or good tone for them to continue working. The other one is the thoracic. The thoracic, the goodness is that has extra support, the ribs.
Oh, okay.
So the ribs protect our internal organs so that the muscles are on the edge of the ribs. So in these muscles between the ribs and the ones on the back along the vertebra, if they get weak, you'll find that you lose posture of the thoracic. Instead of having that curvature, it becomes flat. That means the muscles around it are weak. When it becomes flat, you will feel it even in front of your chest, which we call the chest bone or something of the sort. So those muscles get weak, even the vertebra becomes weak.
So you could even be having
pain on the
chest.
Yes. And you think it is the organs which are inside, but the fact remains it's the weakness of the support of the spinal column around the thoracic. So you have to maintain the strength and that curvature. If you lose it, it will give you problems. The third one is what we call the lumbar or the lowest part.
The lower back.
The support muscles of the lower back are our stomach muscles.
Okay.
Immediately you get a weak muscles of the tummy, which we call the core.
The core.
The core getting weak, you get instability of your lumbar because there's nothing holding it. And when the front or the core gets weak, the muscles along the vertebrae or the vertebral column, they also get weak. And what will happen? The disc can't hold anymore. The spinal column itself gets weak because the support, the corset of it has given up. And that is how you come to have complaints of what? Your lower back.
The lower back.
So that curvature of the lower back is supported by the core and the small muscles of the back of the spinal column.
So it's important to constantly keep strengthening the muscles around the spine.
Yes.
Ah, okay. Dr. Petty, what are some of the ways that some of the habits or some of the beliefs that people have that would make them not recover from spine issues, from disc bulges and all that? What would make it difficult for them to recover or prolong their recovery? Yeah.
I'd say first it's not listening. So patients tend to be very pain driven. They, as long as they feel that you've sorted out their pain for that day, then they can go back to whatever that they were doing, of which sometimes that's the cause.
Yes.
So if you tell them, okay, you are feeling better, we've helped to rehabilitate your back and rehabilitate your muscles. Now you need to start working on becoming better and now being functional. That's where we lose. we
lose very many of them.
because they're like, the pain is gone. Why am I coming to you?
Yeah.
You see. So
until the next time they feel the pain is when they'll come knocking again.
we always just open the doors. We know you'll come back because if you don't go through the whole program whereby we've gone from your taking you away from your pain to now taking you through the therapeutic stages and then to now rehabilitative changes and behavioral changes. Then we have not done everything. Once you lose the pain, you step out. So that creates a lot of problems, which end up most of the time, like in that picture that we saw, resulting in degenerative issues that tend to start earlier than what they are supposed to. So most of the time, that's what delays recovery. When we talk of patients that have disc issues, we need them to really focus not just on removing the pain, but being rehabilitated so that they do better and they take care of their spines better.
So behavior needs to change.
Yes.
And they also need to strengthen the muscles around the spine.
So,
To add to what Dr. Petty has said, the other thing is hearing stories from their colleagues or from somebody distance who will say, you know, I had a disc and the way it was bad, I'm not supposed to turn badly. I'm not supposed even to bed. I'm not supposed to sit in certain chair. Those fears make the people not to heal because they become stiff. They don't do what it is supposed to be done because they don't want to hurt their back again. For example, you get a surgery of your tummy. For example, mothers, they get cesarean section, or people get just what we call laparotomy, that is operation on the stomach. Most of people will say that if you carry anything, you will get back problem. If you push or do anything else because you got surgery of the tummy, you are not supposed to do anything but stay that way. That is not right. Let's not listen to people. Ask the experts. Because immediately you strengthen rehabilitate yourself on the stomach, the stomach muscles needed to support the vertebrae. So if you leave it hanging, it won't support. So it will keep on having disc bulges. Because your muscles supporting the back are weak. So whatever surgery or whatever people are saying outside, don't take it seriously. You can heal and go back to your normal routine. Yes.
That's very important.
And again, just to add to what she's saying, it's not a quick fix. Again, I think there are a lot of patients that we see coming through. Just fix it.
Just fix it.
Yes.
Or they want to pop a pill and it all goes away. Yes.
So, and that's the main thing, that if for you to come to a primary health care giver is so that they find out also what caused the problem and how to prevent it from happening further. Because remember, you don't only have one disc, you have a lot of them.
Discs.
And soon one gives up after another.
It's a domino effect.
Yes, so it's very important to make sure that you are not looking for a quick fix, but you are looking for changing your system of working or your system of behavior that is going to make you not to come back with the same issue again. Yeah.
All right. And Dion, why is it important that the two professions are merged in order to help someone in the healing process of when they've had back pain, when they're having disc issues? Why do you combine chiropractic and physiotherapy?
Okay, why we combine the two professions is that it is as if you can't work without the other. Physical medicine, they work on soft tissues. Soft tissues are the muscles, ligaments, tendons, which are attached to the vertebrae. So for us, we try to get relief of these organs. But you see now when you are having this problem on these muscle, tendons, and so forth, you have caused the vertebrae not to stay in its own position. Because, like, for example, you get a very bad back spasm. The side which is having the spasm.
So let's first understand what's a spasm.
Dr. Patti, what is a spasm?
It's a muscle knot. So
It's a muscle knot.
or muscle tightness that happens suddenly.
Muscle clamp.
Okay.
A
So the
muscle
muscle just
clamp.
tightens
Yes.
suddenly.
So it pulls the vertebrae column to one side. So you find that the other side is forced to change its posture to compensate and help the other side.
Okay.
So in that position, you will find the vertebral column will bend and turn, which means the facet joint we talked about has gone out of position. Not only that, even other organs within the vertebrae, they are all going to be misaligned. So after we make the tissues get better, the chiropractor comes back to move those vertebrae and the joints to make you function. Because already if it turned and put pressure on the nerve, you won't function. So they have that way of doing it to make the nerves function again, and even maybe the vertebrae to come back to their normal position, making you more function. So it helps us to make somebody heal quickly.
Okay.
Yeah.
When the two professions are combined.
Yes.
So you talked about physical therapy, and perhaps it might be better for Dr. Petty to speak on the chiropractic bits. Exactly what happens, and then how the chiropractor now brings a person back to functionality.
I usually have an analogy of chicken and egg theory, which comes first.
Yeah, which comes first.
So it can be either for joints to move, they need muscles. For muscles to move, they need joints.
Yes.
So it's very important that both are healthy in this aspect. Because if the muscles are stiffened and spasmed, the joint won't move, right? And if the joint is fixated or restricted, the muscles can't function, right? Because their main function is to move the joint, and if the joint's not moving, then you know.
Move.
So hence I say it's a chicken and egg analogy that I usually use. That we need to get the joints moving. Let's say that person comes and sees me, and I help with the joint movement, but the muscles are still tightening up. So if that is happening, after a few days of feeling some relief, the patient comes back feeling that same pain because the muscles are still not responding to the instruction of movement. So it's very important to make sure that you are dealing with both components so that you have a fully functional patient, and you've relieved those muscles, and you've allowed normal joint movement to be restored within the joints, which is what we do. And then that allows a optimum level of functionality. Now, in coming to the nerves, as the physiotherapists have said, that a lot of the times when there is lack of movement, those nerves are also irritated, and there's a lot of inflammation because of lack of movement now, because of that restriction that has happened. Once we relieve and now allow movement, those nerves that were busy firing pain to the leg, to the arm, wherever that they were supplying, they now start lowering. Hence, we have things like sciatica, whereby there's nerve pain that is going down the leg. It's because where they originate, there has been a lot of inflammation due to lack of movement, due to muscle spasm, due to abnormal movement. So it's very important to make sure that there is good movement and the muscles are there to support properly, and they are giving enough good tone, because wherever there's a contraction, there also must be a stretch. So if you are contracting on this side, the other side has to stretch. So a lot of times when we are having muscle imbalances that are happening, we are causing a lot of joint mobility irregularities that happen because of that either the miscommunication or misalignments that happen in the spine. So we have to deal with both components.
Okay. All right. So Dion, is it safe to say that disc bulges can be handled conservatively without surgery?
Yes, we can say that, but always the severity of the disc bulge is what we will be able to determine. For example, you might go and find somebody was in a situation where they had to go beyond their effort, maybe to lift or to remove or to help somewhere. They used a lot of external force to be able to help the situation. Because of that, they will find that the disc had to protect the nerve and the cord such that it bulged almost half of it.
Half of it is out.
Half of it is outside the vertebral column. That way, it will cause you even not to feel let's say it is a leg, you won't feel it at all. So you won't recognize whether your leg is there. So any disc bulging causing lack of feeling or non-functionality of that limb, that one we tell people you have to get some help from surgeons. But so long as you can feel, unless the pain is so severe that you can't be able to tolerate even with the painkillers or our physiotherapy, it means that the nerve has been completely being pitched without allowing any more movement. Otherwise, I believe 90% of the disc bulges can be treated without surgery.
Conservatively.
Conservative.
With physio, with chiropractic.
With the exercises. You can go back to normal. And the disc also goes back to normal.
Okay.
Yes.
All right. So this particular topic is very wide and we cannot exhaust it today. And I want us to stop there. And next episode, we shall look at exercises that one can do when they have the disc bulges, when they have all sorts of disc issues going on, and also the consultation process that one undergoes, not only MRI scans, but the consultation process that one undergoes to understand what exactly is happening when I'm having a disc bulge and what needs to change. Yes, so with that, any parting shot, Dion?
I want to ask our community, whenever they have any issues on the back, and you feel as if it is irritating your nerves, so you are feeling the leg or the arm, you shouldn't panic. These things will happen because you are living, and you expect things to go haywire somewhere here and there. Whenever you feel you have issues causing pain on your legs, always make a rest. Go to your bed or on a mat, on a carpet, rest the back, get a good position, and rest there for more than even 2 to 3 hours. The discs will start moving back to their position. Don't force yourself to do things. Rest the spine, and the discs will also settle and get back. So always take time to rest, especially for your spine. You have to take care of it. You have made it to work from morning to evening. When you come home, you are so tired and you feel achy. Just go somewhere for 1 to 2 hours, relax your back, and facing up, of course.
So you sleep
Flat.
flat.
And feel the neck, the back will go. You make your muscles relax. And the discs which you are feeling like bulging, they will start settling back to the position. So always make sure you rest your spine.
Okay.
Yes.
All right. That's interesting. At the end of the day, get somewhere flat.
Yes.
Lie
Relax.
down
Yeah.
as you're looking up, and let the body adjust.
Exactly.
So we shouldn't ignore those little discomforts that we are feeling at the end of the day.
True.
Dr. Petty, any parting shot?
With that being said, how to manage yourself at home. Also, if it's consistent and it's not responding, do see your primary health caregiver, because you don't want to allow that to continue for so long without knowing how bad are your discs or what is happening. If you've basically just strained a muscle or you're having a disc issue. So it's very important that you don't wait until now symptoms have gone way out of control. You are have that middle space. Yes, if there are basic things that you haven't been doing, you've been stressing a lot, not exercising, and all of that. Yes, it's definitely time to take that time to rest and understand what's going on, understand your symptoms, and then if they persist, make sure that you do see your health provider. So in parting, I would say, take care of yourself, take care of your back. Don't stay for too long busy popping pills. I'm not against pain medication. There's a time and space for that, but also in a long run, you really need to understand what's going on in your body so that you are better able to take care of yourself.
Okay. All right. So there you have it, folks. And we shall delve deeper into this particular topic of the spine next time. And we shall understand, when do you see your physiotherapist? When do you see your chiropractor? When do you see your general practitioner? And when to see an orthopedic specialist? So I have been your host, Nelly Ndiga. Do have a lovely evening.